So give it up for Victoria, everyone.
Woo. Thank you.
No problem.
Okay, racial disparity has been a trending phrase for some time. However, the last 2 years has turned the searchlight onto the health sector where such disparity is concerned, especially with the COVID pandemic. To get it right, we must first recognize that racial disparity encompasses more than what we knew as race and racism in the days gone by. Previously, the word race would refer to an ethnic group, people belonging to a specific population, people who share a common cultural background, or people of common descent. Today, the working definition for racial disparity incorporates groups of people having similar socioeconomic status, age, geographic location, language, gender, disability status, citizenship status, and sexual identity and orientation. Now, this is a pretty long list, especially when one takes into consideration the approach or approaches considered to eradicate or eliminate racial disparity. It is commonly believed that to effectively address racial disparity in the quality of care, there is the need for improved data systems, some of what you mentioned earlier, increased regulatory vigilance, new initiatives and strategies to appropriately train medical professionals, and the recruiting of providers from disadvantaged minority backgrounds. But how many of us recognize that this will not solve the problem of racial disparity? How many of us recognize that many persons considered as racially disadvantaged are themselves racist? How many of us recognize that racial disparities in societies, societal institutions, including the health sector, are simply a manifestation of something that lies within humans, individually and collectively? And so, when societal institutions decide to improve data systems, increase regulatory vigilance, employ new initiatives and strategies to appropriately train medical professionals, and recruit more providers from disadvantaged minority backgrounds, all these are band-aid solutions. We have not addressed the root cause of racial disparity. Racial disparities in medical care and any other societal institution should be understood as manifestations of who we are as a people.
We the people.
We the people.
We the people.
We the people.
Are so powerful.
Are so powerful.
Together.
A fact many of us wish not to want to hold on to, we want to deny it. We may refer to racial disparity as aberrant behavior, but every behavior is a manifestation of our internal environment. It is who we are, our thoughts and way of thinking. Racial disparities have taken residence in the human subconscious mind, and this did not happen overnight. It took years and decades of programming. The only way to address racial disparity is to reprogram the subconscious mind. The subconscious mind must be cleaned of the many racial disparity stereotypes those fundamental thoughts about us and others that we have come to accept as reality, those must go. We are defined by our thoughts, but not only are we defined by our thoughts, societal institutions are reflections of how we define ourselves. All our institutions are a reflection of who we are. An old Jamaican proverb states, you can take the pig out of the mud, but you cannot take the mud out of the pig. If the mud mentality cannot be removed from the pig will always be creating a muddy mess in its external environment whenever the occasion presents itself for the pig to do so. And why is this? It is because our mind is our creative force. And what we create and how we behave are reflections of our mind. Any data system, any regulation that we seek to implement, any new initiative to appropriately train medical professionals, and any new recruiting strategies to incorporate more disadvantaged minorities within the sector. All these can only be as good as the mind allows them to be. Before you know it, all such initiatives are corrupted. Chances are we have spent millions of dollars in this arena already, and yet racial disparity persists. But it is no big deal. We can spend some more. Any real move to eliminate racial disparities of necessity requires reprogramming of the human mind. And reprogramming means redefining ourselves. Because, as I said before, we are what we think. And I must say that the majority of what we manifest is not because of our conscious mind. It is a result of the subconscious mind. It is deep within us, and sometimes we are not even aware of the thoughts that are there regarding how we relate to ourselves and relate to others. As a people, do we want to redefine ourselves? Or are we comfortable with creating band-aid solutions for racial disparities? The thing with band-aid solution is that they get old and corrupted very quickly. And as they peel away, they reveal the old, sometimes chronic, smelly sore. One philosopher points out that if the more basic things are not clear, then the less basic things cannot be made clear. And what is more basic than the definition of who we are? If who we are is not yielding the result we desire, we have the power within us to transform who we are. Consciously deciding who we are is dependent on a point of reference. We must state who we are in relation to everything around us, both seen and unseen. It means the fundamental thoughts that confers identity on us must at least be clear on such concepts as existence, life, purpose, law, and relation or relationship. Some will argue that the most significant thoughts within our very crucial point of reference are related to existence. What is existence? Is existence one or many? We need not look very far to recognize that existence is one. We are breathing the same air, airborne viruses, cigarette smoke, and enchanting perfume fragrance. We are connected in a cosmic field in such a way that a war in the East will certainly affect the West and vice versa. And if the have-nots in our presence become really destitute, then those who have will have no peace. Everything is connected. Everything. Racial disparity not only affects the victim, at some point, the perpetrator will be affected as well. When we acquire clarity regarding existence and understanding of life, purpose, law, and relationship is made easier. When it comes to relationship, we will attract thoughts that are in alignment with our concept of existence. And this is taking us to the root of social disparity and inequities. Social disparities and inequities manifest themselves in relationships, how we treat others and think they should be treated because of who we think they are and who we think we are. I know some of you may be thinking, how in heavens and earth will we accomplish such reprogramming? It is not as hard as it appears to be. I can tell you that the media has a track record in this arena. When those who lead us have an agenda that must be realized, the media is at their service, programming and reprogramming the population to ensure that the goal is achieved. This sort of reprogramming cannot be done by the health sector. And any attempt the health sector makes at eliminating racial disparity before this programming is initiated will be corrupted by our present stereotypes and way of thinking. Racial disparity must be dealt with on a broader scale that addresses the root cause. The root cause must be exposed. The root cause must be eliminated. Remember, healthcare disparities occur in the context of a broader inequality. Yes, we know that disparities in healthcare exist and are associated with worse health outcomes. Yes, we know that there are many sources across health systems, providers, patients, and managers that contribute to disparities. And yes, we know that bias, stereotyping, prejudice, and clinical uncertainty contribute to disparities. And we have known these for a very long time. When you browse the internet, there are myriads of papers and journals discussing this problem. And some of these journals and papers are very old. They have been there for a few years to tell us how long we've been having the problem. Very few papers address a band-aid solution, and a minuscule number reference the direction we should take to achieve lasting solution. Now, the big question I would like to leave with all of us today is, do we really want to solve social inequities, or are we comfortable with band-aid solutions that can never, ever remedy racial disparity and social inequity?